Welcome to Adventures in Life. I'm Earl Beecher, your host. Our guests today are Dr. Andrew Rawlings and his lovely wife, Tessa Rawlings. And he is a chiropractor whose practice is in Irvine, California. And Andrew, I'm going to call on you first to explain a little bit about chiropractic. What is unique and different about it from other medical type things?
Well, chiropractic approaches health from a more holistic point of view, where we believe in prevention and function of the body, and that the nervous system controls all systems and organs in the body. And if the
Wait a minute. I thought chiropractic dealt with the skeletal system.
It does. The nervous system and the skeletal system. But the nervous system first, and the nervous system happens to run through the skeletal system. The skeletal system is a protective mechanism for the nervous system.
Say that again.
The nervous system is so important in the body that it's the only system in the body that's protected entirely by bone. You have the skull, you have the vertebra down the spine, so that almost all of the nervous system is protected within a bone. We have the rib cage and the vital organs inside, but they're basically ribs and spaces, whereas the brain and the spinal cord is surrounded completely in bone with only little small openings for the nerves to exit.
I never thought of it that way before. That is interesting. And so when you're studying chiropractic, you're studying the nervous system as much as the backbone.
Correct.
I think most of us think the backbone, you go in and somebody gives you a twist here or something there. I have been to you a couple of times for treatment, and I found that you are very gentle, despite your size,
Yes.
compared to the other chiropractors I've been to. Why?
Well, each chiropractor has his own style based on where he went to school, how he likes to be adjusted himself, and quite honestly, body size. In order to adjust a spine, you have to apply force. To apply force, there's a physics equation that says F equals m times a. M is mass, a is acceleration. I have a lot of mass. I don't have to go as fast in order to do the adjustment.
So, and you even use a machine sometimes.
Correct.
What's that thing called?
Well, there are several that we use in the office, but I believe the one you're referring to is called the Atlas Orthogonal instrument. And it adjusts the atlas, and it makes it orthogonal, which means perpendicular to the vertical axis of your body.
Okay, what's the atlas and orthogonal? I warned you before we went on camera that you use big words like that. I'm going to have them explained.
Certainly. Well, the atlas is the top vertebra in your spine, okay?
The top one.
The top bone in your spine, the first one right underneath your skull. And if you remember, Atlas held up the world. Well,
yes.
Your atlas holds up your skull or your world. And that's the first vertebra, and it is so important because in a space that's about a half an inch around, all the nerves that exit your skull and go down the spinal cord are within that bone.
Does it have a larger opening than the typical one would?
The neck vertebra actually have a smaller opening than the low back ones do, but the nervous system actually fills more of the space than it does in the lower back.
How do you know when a person has a problem?
Well, most people come to my office with some sort of pain. They're hurting, and that's usually what brings them in. And chiropractic is really effective in helping people with their pain, but chiropractic also can help other conditions that they might not think were chiropractic related.
Like what?
Well, many people don't talk about these other conditions that they're having, but a lot of patients will come back to me and say, Dr. Rawlings, I didn't tell you about my asthma, or I didn't tell you about my constipation. Or
I didn't tell you about my asthma.
Well, many times they'll come back and say, but it's gone, or it's better. And it has to do with making the nervous system work better by removing the nerve interference, and then all systems in the body can work better.
The nerve interference?
The pinched nerve.
The pinched nerve.
That most people
something that's interfering with the nerve, not the nerve causing it.
Correct.
Okay, I think I got that one. All right. Now, your wife works with you in the office, and so you don't do any of the actual chiropractic.
No, no, I don't.
You do all the bookkeeping and appointments. And
I work at the front desk. I help with the appointment books, answering the phones, greeting the patients, making them comfortable.
But I would imagine you get a lot of questions from mothers.
Mm-hmm.
What are some of the most common ones?
Should I bring my child in? Should I bring my child in to see a chiropractor?
Well, that's one of the reasons I asked you to be here today.
Yes.
You do treat children.
Yes, I do.
And one of the
I didn't think children needed it. It's just us old folks.
Well, they have a spine.
Well, true.
Kids get headaches, and that's kind of a parent wouldn't say, oh, my child has an ear infection, or my child has scoliosis or something. They might not even know what that is yet, but
You're
they might
not
say,
going to get away with that one.
no, but they might say headaches, and you know, that's something that you would come into a chiropractor for, even when you're a child.
A chiropractor.
Mm-hmm. Mm-hmm. For headaches.
What was that big word again?
Scoliosis.
What does it mean?
That's Dr. Rawlings.
Scoliosis is an abnormal curvature of the spine, and it occurs most frequently in children. And if you imagine looking at somebody's back from behind, their spine should be straight like an arrow. If you look at them from the side, their spine can be curved. But on that back view, when it is curved like an S, that's scoliosis.
Oh, it's curved sideways.
Correct.
Not just forward and back, but
Correct.
sideways.
Sideways.
I always carried everything in this arm so I could load it with that one, and is that could cause a problem?
That could cause a type of scoliosis. So in children, many times it's called idiopathic, which means there is no known cause for it. But if you have enough pressure on a nerve that controls a muscle along the spine, you could cause a muscle spasm that pulls the spine.
And the person
to
gets
the side.
sort of a permanent stance from it.
Correct, and it's so important with children because they're going through their rapid growth phases. Their bones are growing so fast, and that if they're curved while they're going through that rapid growth phase, they could become a permanent curvature. So there's a phrase called, as the twig is bent, so grows the tree.
Well, I heard that one from the Bible.
And it applies to young spines. So that's why it's so important to adjust children and get them checked.
I see. Now, how do you get them not to have that problem?
Well, a thorough exam by a chiropractor is very important to look for any areas where there's pinched nerves or inflamed nerves causing the muscle spasms. If they don't have that type of finding, then maybe a chiropractic isn't going to help them. But if they do, and I've seen it many times in my practice where we can take a bent-over kid that's all off to the side and straighten them out. And they stay straightened out because you've removed that nerve interference.
That just raises all kinds of questions in my mind. Number one, how do you determine that there is a pinched nerve? Is it because they're reporting pain, or is there something else you look for?
Well, many times people report pain, but in order for you to have pain, a nerve has to be pinched off by almost 70% before you get pain.
70%?
So that's your pain threshold.
Okay.
So below that, you still could have a pinched nerve but not feel it. So we don't go just on pain. We would use an orthopedic exam, neurological exam, chiropractic exams, palpation, which means we just run our fingers down the spine, and all those things.
You can sort of feel if something's out of alignment.
We can feel that, and swelling, and inflammation, muscle spasms, yes.
How can you tell it's swollen?
It's a density issue. You take a down pillow, and you feel how soft that is, and you take your hand and you put it on the arm of this chair, and you can see that there's a different density.
There's a different...
So the harder the density, usually the more swelling there is.
What causes swelling?
Pooling of blood usually is what causes the swelling.
What causes the pooling of blood then?
Well, that's a good question. Sometimes it's an injury, like if you twist an ankle, you've injured an area,
Yeah,
and your
that
body
I
is
can
going
understand.
to send blood in order to heal it. But you also have abnormal nerve function causing a muscle to not work right, and part of that function is telling that muscle to move some of that blood back out. So it's an abnormal function that lets blood pool sometimes.
So you can look at a person. I thought maybe you had to take an x-ray every time or something like that.
Well, x-rays are a very helpful diagnostic tool. They're not required in every case. In a lot of cases they are, and most of the time x-rays are used to confirm what we already suspect from our consultation and our exams.
Okay. Now, the mother brings in a child, and the child is complaining. What triggers her to bring the child to you rather than, oh, they're just cranky today?
Well, if I can interject, that the patient or the mom that's bringing the child in, she's already being educated by the chiropractor. By coming in and seeking chiropractic for herself, she's already understanding that, wait a minute, if I'm getting headaches, and my headaches are getting better by going to the chiropractor, or if I'm having backaches, what about my child coming in? And so she's already knowing if a patient...
So she believes in the practice of chiropractic and
she's
helping her already.
Mm-hmm.
I see.
Yeah.
Can a person's vision be affected or
Yes.
improved through chiropractic?
In some cases, yes.
We need to go to a public service announcement, but I want to come back to that one. So stay with us. We'll be right back with Dr. Andrew Rawlings and Tessa Rawlings. Our guests are Mr. and Mrs. Dr. and Mrs. Andrew Rawlings. And I had just asked Andrew about vision. How can chiropractic help a person's vision?
Well, it can't help in every case, but the eyes, like your ears and your nose and your tongue and your mouth, are supplied by nerves that are called cranial nerves. They come off inside your cranium, and they exit the nervous system in the back of the cranium here, which is just above the neck. Mm-hmm. So if the neck's out of alignment and putting pressure on the base of the brain there, you can have pressure on the cranial nerves.
Do you have a lot of people come in that are at the computer for hours and hours, and as a result they're having problems?
Mm-hmm.
Yes, the advancement of modern man, yes.
Yeah, I love the way you say that. So our activities do affect what we do. Mm-hmm. When we took the break for the public service announcement, Tessa was telling me, you've got to walk, and most of my viewers know that my doctor told me I had to go walk every week. And repeat what you said about walking and maintaining a certain level of activity, especially older folks.
For the mature generation.
The mature generation. Thank you. You're so kind.
And, well, chiropractic helps to help keep your activity level at whatever age, and you're encouraged to walk and keep moving. But if you can't walk and you can't move around, that's when chiropractic can step in and help you maintain your activity level.
Well, when I get through walking, it hurts here, and it hurts here, and it hurts here. And I go back to the doctor and I say, you're mean. And he just laughs at me. He says, well, do it.
But if you don't walk, you're going to forget how to walk.
Forget?
It's...
If I could jump in here.
Yes.
The benefits of your walking are always going to outweigh the side effects, the knee pain and so forth. You will be far, far better off for many years to come if you're a walker. And I've been to health fairs at senior citizen centers, and you can walk into that room and start pointing around the room and say, walker, not a walker, walker, not a walker. And you can instantly see the people who have been active and have continued their walking program all throughout their years. And it will be very, very obvious.
What's the clue? The way they hold themselves?
Bent over, shuffling, unsure gait, or people who are upright and actually have a spring to their step and actually have some distance in their stride. It's very obvious. So although you might not like your doctor for recommending it, you're better off.
I like him. I know he's on my side.
Yes.
but it's still, you know. Tell me, what age does all this set in?
Well, it depends on a lot of factors. If you've played, say, high school football and college football, it'll start setting in by about the time you're 25. If you've had 2 or 3 or 4 car accidents, it'll start setting in maybe by 35. If you're a normal active person and you've been under chiropractic care, you know, 2 or 3 times a year for your entire life, it might not set in until you're 55 or 65 or maybe even 75. So it's how much stress and strain your body has taken without proper care, and that will really set your time frame.
Oh, you just raised 2 or 3 subjects that I want to explore.
Good.
One of them is sports, school sports.
Yes.
This covers the children thing as
Yeah.
well. You said that your daughter loves to do gymnastics.
Gymnastics, yes. But actually both our daughters, they're 7 and 9, Megan and Kelly.
Yes.
Kelly's 7, Megan's 9. And they were both in gymnastics until the level of gymnastics, the bar was raised, if you will. And they're quite tall for their age, and they're growing quickly, and so they're going through growth spurts and growing pains. But the impact of gymnastics, the tumbling that they do, the handstands, the somersaults, the back bends, it started taking a toll.
I couldn't believe what some of the girls did
anymore.
when I was watching the Olympics. Just unbelievable.
And those are tiny little girls.
They have to be small to flip that fast. Yeah.
So.
Do you recommend then that the children avoid sports?
I recommend that children avoid certain sports. Football for the boys and gymnastics for the girls are the ones that I would prefer they did not participate in.
You watch them pretty close then.
Correct. However, again, the same thing applies as to your walking. The benefits of an exercise program or a sport will almost always outweigh the bad effects of it.
Even football and gymnastics?
No, except for those two. I do not believe that those two are worthwhile. I feel that the risks of those outweigh the benefits.
What are some of the sports that you particularly recommend, like maybe tennis and baseball and swimming, or what?
Swimming, excellent. Soccer, excellent. Tennis is pretty tough with
You're pounding on the pavement, I know.
Well, it's more the serve. The serve and competitive sports, throwing the ball up really high, cranking your neck up to see it, that's pretty tough. But again, that's on the fence, so to speak, or on the net, so to speak. But swimming's excellent. Running is usually pretty good. Soccer is great. Just about any other sport is worth the effort. If the child enjoys it and wants to do it, do it.
Football, it's the pounding you take when you...
Exactly.
You did football.
Recent research has shown that a high school football game once a week is equal to an automobile accident once a week.
Whoa,
Ouch.
That got everybody's attention. A very dear friend of mine, his son is 30, and he was in his car, and he was stopped, and a truck hit him from behind doing 60.
Oh.
And he said he's been having a lot of pain lately, and I said, I can imagine why. You get a lot of accident victims?
We do see a lot of auto accident victims in our office.
Did you give him a card?
No. He lives quite a ways away.
Yeah, the forces involved with automobile accidents are astronomical. You take a truck traveling at 60 miles per hour,
Yes.
running into the back of a Honda.
Well, it was another truck, fortunately.
Well, fortunately, but if you can imagine in the back of a Honda how the person in the Honda is going to lose. It's just kinetic energy. The weight of the object times the speed of the object is the amount of kinetic energy that's transferred into that car, and it's a no-win proposition when you're rear-ended especially by a bigger vehicle.
Yes. Well, or hit by the side or whatever. Anytime you're in a traffic accident. And so people are coming to you more and more for this reason, I guess, because traffic is getting worse around here.
Yes.
And the nervous strain of sitting in traffic, how do you handle just plain stress?
Well, stress is the #1 recreator of almost every health problem. It's the #1 way that you will get out of adjustment because of the muscle tension in stress. It comes from the fight or flight syndrome. Have you heard that phrase?
Yes.
Our ancestors came across a grizzly bear. They had 2 choices, run or fight.
I'd run.
Okay? Well,
But the bear can run faster is the problem.
So we deal with our stresses in the same way. Our body prepares ourselves to run or fight. Okay? Most of us walk around enough that our glutes work out, and that's not a problem, but few of us get enough upper body exercise to deal with that fight component.
Are there any special exercises a person should know, especially maybe somebody of the, how did you put it politely?
Mature generation.
The mature generation. I always say the old folks, but...
Well, again, walking is the best exercise for just about everybody, and it should be 30 minutes to an hour of walking 3 times a week. And that's very, very important. And then, depending on their interest levels, they can get into, you know, weightlifting at the gym, working out at home, or some sort of interactive or competitive sport to keep their interest up.
So golf is good?
Golf can be good, but it can lead to a lot of problems in and of itself because of the rapid twisting and turning.
Yeah.
Recent research has shown that 1 out of 2 golfers plays in pain. So just about every other golfer on the golf course is hurting, but he's so hooked on the game that he's still out there.
He's going to stick with it. How about bowling?
Bowling's pretty good. It doesn't have a lot of stress on it, but it also doesn't burn up a lot of calories, though. It doesn't get the heart rate going a whole lot.
I see.
And the heart rate is obviously an important factor in your exercise
So when a
routine.
person comes to you to get a treatment, they're going to get more than just a little work on the spine or something. They're going to get a program where you tell them this is what you should be doing with your lifestyle as well as. Is that right?
Mm-hmm.
Exactly.
And for children too?
Yes.
You tell a mother this is what you should watch for with your child and encourage.
And he gives out exercises that they can do, ergonomics, kids that are...
There's that word. I heard that before.
It's the proper
It's
way of
how
sitting.
you do what you do.
How you do it.
But most parents will bring their kids into us because they do their homework on their bed or in a beanbag chair or
You know, they're
slouched
laying on
on
their
the couch.
stomach.
And they get their
and they're
posture
reading.
like
Yeah.
this.
They got a backpack on one side instead of even on both sides, like carrying a backpack evenly. They'll carry it on one side, so they're starting to feel back pain and neck pain from that. So it's kind of a coming into our office, or Dr. Rawlings' office, it's education. You know, they're learning what to do.
You don't have classes, do you?
Yeah.
Actually, I do.
Yeah.
Every other Wednesday night at 6 o'clock, we offer a 1-hour class for all of our new patients, and it's open to all of our patients. That teaches people how to get better faster, things they can do to take care of themselves. We cover diet,
I'm going
exercise,
to do something I
nutrition.
know you're going to be sorry for. Where are these classes taught? At 6 o'clock on Wednesday night?
6 o'clock in my office on every other Wednesday night.
And it's
And
free.
you're at the corner of Jeffrey and the 5 freeway.
Jeffrey and Walnut, right off the 5 freeway.
And how do they find your office? I know it's tricky because it's upstairs.
Yes, it is. But we do have an elevator, though, so that makes it a lot more
Or they
convenient.
could just call our office and I can give them directions.
Okay. They tell us it's time for another public service announcement. So
Okay.
stay with us. We'll be right back with Dr. Andrew Rawlings and Tessa Rawlings. Our guests are Dr. Andrew Rawlings, R-A-W-L-I-N-G-S, and his lovely wife, Tessa Rawlings. And is there any advice you'd like to give our viewers as we wrap this up?
Well, I'd like everybody to kind of take the big picture of what the nervous system is. And the nervous system is responsible for all systems in your body, including circulatory, respiratory, digestive. All systems in the body are controlled by the nervous system. So if your nervous system is not working the way it should, other systems can be adversely affected. And one of those systems that's very important is the immune system.
Immune system.
The immune system, how easily we fight off colds and flus and viruses and so forth. Many patients will call our office and say, I can't make it in today because I'm sick. Well, that's the day they need
I'm
to
too
come
sick
in.
to come in and see you, doctor.
Well, that's the day they need to come in because their immune system's fighting something. And that immune system needs all the information it can get from the brain. So making sure that there's no interference between point A and all the different points of the immune system is very, very important.
I was thinking about that, and I was wondering how much do you address the issue of diet? Because this has been a big thing lately.
Well, diet is very important because if we have more weight on our frame than we should, then our joints are going to have more stress on them and they will deteriorate more rapidly.
Well, when I go to Disneyland, I look around and I see almost everybody is this shape, not this.
Yes.
It's amazing how many. I would say 3/4 of the people look overweight. And it's a pretty good cross-section when you sit there and look at everybody walking by, you know.
And it does have a negative effect on their spine as well as all the other systems in their body.
It would, just carrying all of that. I want to thank you for being our guest. I know there's something on the immune system. Are there exercises you should do or what?
Not specifically for the immune system, but overall, body health will be related to how active you are, what type of activities you participate in, also the kind of foods you eat, the kind of supplements you eat, the kind of water you drink, the way you think. All those things are affected, will affect the immune system too.
We only have about a minute left. Tessa, I wanted to ask you, do you have any advice for the mothers?
Well, speaking from experience, having two daughters that have grown up with chiropractic, our kids know when they need an adjustment. They come home, their back hurts, their knee hurts, their ankles hurt, and they know they need an adjustment. And it just takes a trip to the chiropractor, Daddy, and and it's taken care of. So it's great for the kids to learn early on how to take care of their bodies and understanding what's going on with their bodies when it's hurting, and how to take care of it so that they're going to have a better future in their adult life. So.
And you also mentioned there's more to it than just the backbone, anything that deals with the joints.
Anything that has a joint, Dr. Rawlings?
Anything that has a joint can be out of alignment, and if it's out of alignment, just the front end, like the front ends of our cars, it's going to wear unevenly.
I see. I want to thank you both for being our guests today.
Thank you.
I appreciate your coming, our guests, Dr. Rawlings and Tessa Rawlings. And I want to thank our viewing audience for joining us, and please join us soon again for more Adventures in Life.